As you know, October is Breast Cancer Awareness Month. We're focusing a lot on it here on 3+U, but this morning some new information that many women, I'm included in that category, and might not be familiar with. So happy to have Dr. Taylor Rowlett here. He is a radiologist with CHI Memorial, the Mary Ellen Locher Breast Center. Good to have you here this morning.
Thank you. Thank you for having me.
You were telling me that 1 in 12 women?
1 in 8.
1 in 8 are still affected by breast cancer. That's a high number.
Yes. So on average, 1 in 8 women, or 12.5% of women, are likely to get breast cancer at some point during their lifetime. That pretty much means that every family is affected by breast cancer.
Right.
For me, it's either going to be my wife, my mother, my 2 daughters, my sister, my aunts, or my grandmothers. That's 9 people right there. So one of those people is likely to get breast cancer at some point, and every family is the same way.
What's so frightening about it, though, is that there's no rhyme or reason to who is impacted. Certainly there are families out there who have it as a genetic trait maybe in their family, but you're seeing women in your office every day who are just out of the blue and at younger and younger ages being diagnosed.
Correct. And it is scary. There are some risk factors that have been studied and established over the last 20 to 30 years. The one that you mentioned, genetic predisposition. So that was a great discovery when the BRCA1 and BRCA2 genes, BRCA1, BRCA2 genes were discovered. Those genes, if you have one of those mutations, your likelihood goes from 12.5% up to about 50 to 60% of having breast cancer at some point during your lifetime. So that's pretty scary.
Right.
Fortunately, most other risk factors aren't that way. If you just have a single first-degree relative, your mother, your sister, or your daughter who's had breast cancer, then that risk is real and it's elevated beyond 12.5%, but it throws you closer to maybe 18 to 20%. Some other ones are estrogen exposure over your lifetime. So if you started your menstruation early, or if you have late menopause, that longer time period increases your risk overall. But the one that's really gotten the most play in the press recently is this idea of mammographic breast density. And it's a little bit hard for women to get their mind around unless they see it maybe.
Okay, so try to walk us through it. You have some images on your iPad that you'll share, but as I'm understanding it, so you go in to get a mammogram, but then the way that mammogram is read essentially depends on your individual makeup. Is that right? So you obviously can't change your individual makeup, and you're going to end up with a mammogram that looks somewhere. Let's actually go to this image here. Your breast is going to look somewhere between here, which is an extremely fatty replaced breast, versus an extremely dense breast, where fibroglandular tissue in the breast is white. And as you go along this spectrum and you have more density in your breast, then the risk of having a breast cancer in there goes up some. And that risk is on the order of 1.2 to 2 times increased likelihood. Okay, so does this transformation happen with age, or can anyone have this more dense breast tissue than the other?
Yes. So typically women that are under 50 tend to be at this end of the spectrum with denser breasts.
Okay.
Women and then as you age, especially as you go through menopause, your breast density decreases. Okay. And so women in their 70s and 80s tend to be more fatty replaced. Okay. However, we see plenty of 70 and 80-year-old women who have dense breasts, especially those that are thin.
Okay, so does this mean that with the increasing number, at least it seems like we hear, of younger and younger women, I had somebody on just last week who was 33, I think, when she was diagnosed.
Right.
Does that mean then that if you're a younger woman going in for a mammogram, you should say, hey, I'd like to have the dense breast screening?
So, perhaps.
Okay.
What we do at Mary Ellen Locher Center is we inform women that there are additional options. The main one that we have at the breast center is breast tomosynthesis. Okay. We've been using that for about 5 years now.
That's a 3D image,
That's
basically?
a 3D breast imaging, yes. And so women with dense breasts, we often, we try to educate them and make them aware that there is this additional screening option available for them. And if they're willing, then we go ahead and we do that at that time as well.
You know, you mentioned the screenings. It can be confusing out there because we've always heard for a long time anyway that you ought to get that first mammogram when you're 40. And yet, didn't the AMA recently come out and say, really not until you're 50 do you have to? But yet the medical doctors on the ground anyway still want to see that age 40.
Right. All actual medical societies will agree that the most lives and most years of life are saved when screening mammography is initiated at age 40.
Okay.
The issue becomes, yes, the United States Preventative Task Force and Services has recommended a later age or going every other year. But if you look at the data, the most lives are saved starting at age 40.
And most insurance companies recognize that too, right?
Yes. To this point, still they are paying for mammograms starting at age 40 on an annual basis.
Okay, you said earlier in our conversation that there's been a lot of media attention about this idea of the denser breast screening.
Right.
NBC recently did a story that's getting a lot of calls into your office on something that's so revolutionary, it really isn't even mainstream yet. Is that right?
Correct. So we have, at Memorial and Locher, we can do breast ultrasound as supplementary screening. We can do breast tomosynthesis, and we have breast MRI available. So those are the three mainstream ways that you can do additional imaging beyond just mammography alone. What's coming on the scene is molecular breast imaging, and we've actually known about it for a number of years. The problem is the technology hasn't been sound enough to make it worthwhile for population-based screening. So in recent years, the technology's gotten better, mostly the imaging equipment. And so at this point, it's still in the research phase, but maybe it's 1 to 2 years out, potentially, before it hits sort of mainstream. That study is, we refer to it as molecular breast imaging, or MBI. And the way it works is it takes advantage of the physiology of the breast cancer as opposed to just the anatomy. And so think about when you go in for your mammogram, you go in, they compress your breast in 2 directions.
Right.
The x-ray beam goes through the breast and it creates an image on the opposite side.
Right.
With this technique, with molecular breast imaging, we give you an IV, a radioactive substance, a radionuclide is injected. It goes to the breast cancer, specifically to the mitochondria of the breast cancer cells, and it then emits the radiation out, and we have a detector on the outside that detects that radiation as it comes out.
So it's seeing it as it's forming almost, is that
well,
right?
it's seeing it because it is metabolically active, and it allows us to visualize it. And I'll just share with you 2 images here. So this is a mammogram on this side, a standard what we call craniocaudal view, where you're compressed from top and bottom. And there's scattered fibroglandular densities here. And if you look at this, you'd probably just call it normal.
Okay.
But however, when you get the molecular breast imaging done with it, you see that the breast has this homogeneous background of light gray.
It looks like space.
It looks like space, yes. We often call nuclear medicine unclear medicine.
Okay.
But the beauty of this is that the cancer right here, which is a 4-centimeter invasive lobular cancer, is taking up the radionuclide, and you can spot it right there. And you're not worried about the busyness of the breast because it's a homogeneous background.
He and I were saying that we wish we had more time to talk, and boy, do I wish we had more time to talk. I think the takeaway is that at Memorial and Locher, the 3 currently mainstream, most cutting-edge ways of looking at a mammogram are being done right there. They're very well aware of this newest development and are waiting for it to come their way as well. 3 campuses where you can make your appointment. Here's the main number, 495-6744. Dr. Taylor Rowlett, thank you so much for the education.
Yeah. Thank you. Appreciate it.
We're back after this.